afternoon, everyone. Sorry to be again a few minutes behind, which is my bad. It's good to be in Bergen County. I haven't been here in a couple weeks, Jim. I've been under the weather, so it's nice to be back. I also want to thank our friends, in particular Bergen County College here, starting with President Dr. Michael Redman, who's a dear friend. I want to thank him for hosting us so graciously today. As he always said, I had the great opportunity a couple of years ago to deliver the commencement address to the graduates of this fine institution, and it was one of the highlights of my time as governor, and I want to thank him and his team for opening their door to us today on this campus and the community, and obviously it's been a big day here, more on that in a minute. I'm here with a cavalcade of VIPs, so I want to thank the woman who needs no introduction immediately to my right, the Commissioner of the Department of Health, Judy Persicelli. Judy, as always. To her right, Congressman Josh Gottheimer. I'll speak about him in a moment. I don't know where we'd be without his tenacity and leadership. Josh, thank you, man. Great to have you. To my left, another warrior, another great leader, Bergen County Executive Jim Tedesco. Jim, thank you for all of your help. I got way down to Josh's right, at the far right, the Superintendent of the State Police, Colonel Pat Callahan, as well as the Assistant Commissioner of the Department of Health, Chris Newworth, and they have been deeply involved with a whole range of initiatives, including the testing that we did today here at Bergen County College. And then in the category of special, very special guests, we have immediately to Jim's left, the Executive Vice Chairman of BioReference, Dr. John Cohen. John, great to have you with us. It's an honor to have you. To his left, LabCorp Senior Vice President Bill Haas. Bill, thank you for your being here and for your help. And the guy who oversees the Department of Health's testing, Dr. Tom Kieran, in the end of Rutgers Robert Wood Johnson Medical School. So to you guys, thank you for your presence here today. We'll hear from at least a couple of you. I want to go back to Josh Gottheimer, and I want to acknowledge his leadership and partnership in seeing that the needs of New Jersey and of our families are being met at the federal level. We also know that our work is far from done. In particular, we're going to need strong federal action to assist states directly. This is something that my fellow governors and I made very clear to President Trump and Vice President Pence, not just yesterday, but certainly yesterday on our video conference. For just to give you a sense of the numbers that we're talking about here, and I might add that I had a very good conversation with Governor Cuomo this morning, and Governors Wolf, Governor Lamont, and Governor Carney, now from Delaware, who is also in our cabal. We've had very good exchanges here over the course of the day, and I'm speaking to at least some of them directly later on. But just to give you a sense of the magnitude of the federal assistance, and we're talking about now direct cash assistance. There's a term of art, block grants, which you may hear, but just the 4 states, New York, New Jersey, Connecticut, and Pennsylvania, we think roughly we're going to need $100 billion of direct cash assistance to help us get through this emergency and to be able to recover. Now, New Jersey's the state I know the best. We're at the front lines with the workers who are going through hell right now, with the small businesses, with all of the various communities in need, and we are filling that void. But at the same time, this is really expensive. The meter's running. The best way, without question, for us to solve that riddle is to let us continue to be at the front lines and to get that direct cash assistance to come in and help us to continue to fund that assistance in those programs, which are now myriad and costing many, many hundreds of millions of dollars over the next very short period of time. So Josh, for that, I want to thank you and your colleagues. We have the best federal delegation in the entire state. I was back and forth, another example, with Congressman Donald Payne earlier today, whose subcommittee in the Department of Homeland and the Committee of Homeland Security oversees FEMA. And I want to give FEMA Region 2 a big shout out for their help in our testing today here on campus. But Donald Payne, again, I could say something about literally every one of the members on both sides of the aisle. But Josh, we're in your backyard, man, and God bless you. We'll hear from you in a few minutes. And then the man to my left, to the county executive, another dear friend. I thank you, Jim, for your strong leadership over the past couple of weeks. This county, and you'll hear it again today from the numbers that we report, is being hit the hardest in our state. And you have been called to make some very tough decisions to keep your residents safe. We've been working together throughout, and I thank you, Jim, for your partnership. Bergen County is in the very best of hands. Just to give you another couple of updates since we last saw you, I mentioned Judy and I and others were on with the President and Vice President yesterday. We reiterated our thanks for the sort of boots on the ground FEMA Region 2. By the way, Jared Maples is with us, Director of our Office of Homeland Security. And Jared, thank you for everything you're doing in overseeing our emergency response. We thanked the President and Vice President for the boots on the ground and the cooperation. We also reiterated that we continue to have outstanding needs in personal protective equipment. We put a big ask in. We've gotten a fraction of that. We are not sitting on our hands. We are aggressively going out and trying. Judy will go through some of this, sourcing other avenues to get that PPE, but there's nothing like getting another big slug out of the federal stockpile. Josh has been very helpful with his colleagues on that front as well. And then we reiterated that we're going to need the direct cash assistance that I referred to. So that was a constructive conversation. We're still not there yet, but it was a constructive one. We had a very good meeting face-to-face in Trenton at the Rock, hosted by Colonel Callahan with the Army Corps of Engineers. And Judy and Chris and Pat sort of went through sort of how we see the need for more beds. Again, remember the two, in addition to testing, which we'll come to in a minute, and caring for the sick and those in need, which are two big initiatives. There are two other ones, the hip bone connected to the thigh bone. One is to flatten the curve through aggressive social distancing, and we're going to tighten the screws further. You should expect to hear more on that by probably tomorrow morning. But we're going to continue to tighten the screws over here, so we relieve the pressure over here. But we can't rely on the timing of this, so we must buy an insurance policy over here, and that is to find a way to reactivate or activate many hundreds more of critical care beds and units. And so the Army Corps is particularly valuable. Judy will give you a quick sense of how that process is going. We had a good call last night with the White House Chief of Staff, Mark Meadows, who himself is new to the seat, a former colleague of Josh's, and himself getting over, I think, self-isolation. He said he's in good shape physically. We reiterated with Mark our specific asks that we've been making of the federal government. We had a good call earlier today with the Secretary of Defense, Dr. Mark Esper, and that actually was a good conversation as well, reiterating, you know, we may get a little boring here for you, but we're consistent. Our asks are, you know, pretty much every time out, more PPE to protect our extraordinary healthcare workers, the heroes, our first responders. Secondly, the boots on the ground, as FEMA Region 2 has showed this week with extraordinary support, the Army Corps, potentially the VA, other actual tangible sources. We mentioned with Dr. Esper the possibility to get some medical personnel from the Defense Department. And then the third piece, again, is we're going to need, as I said, we're going to need a bigger boat, and we need a lot more money to allow us to continue to do what we're doing. Again, I repeat, New Jersey, New York, Pennsylvania, Connecticut alone, we think direct cash assistance in the order of $100 billion. I've also, as I mentioned, had a long conversation with Governor Cuomo today. We've been back and forth with both them personally as well as their teams, with Governors Lamont, Wolf, and Carney, among others. I'm scheduled to speak later today with some other governors who are doing great work on both sides of the aisle, Charlie Baker in Massachusetts, Jay Inslee in Washington. So the comparing of best practices, comparing notes, et cetera, continues to be a source of great strength for all of us. A few minutes ago, Tammy and I, the First Lady's here, nice to have you with us. This is the closest I've been to her in weeks. A few minutes ago, I had the opportunity to check in on the drive-through testing operation that began this morning here on campus. This is an important step for us to dramatically ramping up our testing capabilities, and I just want to say they deserve the victory lap and the credit, but you're going to hear that we tested today 600 people successfully, which was beyond our wildest dreams. And Judy and Chris and the Bergen County folks and the Paramus folks and the folks under Jared's watch, and I know Josh was deeply involved in this. And then, of course, the back-end testing. These guys to my far left are going to be the ones who will then take these swabs and go in and test them. But just a Herculean, not without bumps in the road. As we said, we've never done this before, and to say there was pent-up demand would be the understatement of the century. But considering all that, I don't think in our wildest dreams, guys, we thought you'd test 600 people. So, and again, just to repeat, we understand and appreciate the tremendous anxiety that so many residents feel. We know that from the hotline, phone calls, and messages we've received through email and social media, that access to testing has been an overriding concern of residents. But I must reiterate, and please again allow me to say this, not everyone should hop in their car and come here to be tested. Individuals must be current New Jersey residents. You have to show your own identification, and you've got to be showing some symptoms of respiratory illness. If you are feeling perfectly healthy, if you are among the so-called worried well, there is at this time no need for you to get tested. Let's ensure that our resources are available first and foremost to those who are at greatest risk. And again, I must thank all of the medical personnel who are taking samples and working to ease people's anxiety, to members of the Department of Health's Emergency Management and EMS staff, the state police, the New Jersey National Guard. I want to give them a big shout out, who are keeping the public safe, and to the team from FEMA for their partnership in setting up this testing site. As I mentioned, to our Bergen County brothers and sisters, our Paramus brothers and sisters, to each and every one of you, thank you. Today, in terms of the numbers we learned, I should say one other thing. Testing, Chris, am I okay to say this? Testing on tomorrow morning, 8 o'clock, right here again, and you all will go until you get to 350 tests, is that correct?
That's correct. Yeah.
Right? So we'll go to we'll open up for business again tomorrow morning. Again, bring an ID, and you must be symptomatic and or have a medical permission slip, as it were. We will, in addition to this, open up the second FEMA site on Monday. As we have mentioned to you all already, to preview this, it's at the PNC Bank Arts Center, the parking lot, which is in and around the exit 116 of the Garden State Parkway in Homedale. It'll be Monday, March 23rd, unless you hear on social media otherwise. It will be at 8 a.m. We will have, according to Mahan, a website link to up soon, but not yet. And Mahan tells me do not visit PNC today or over the weekend. We need time to set up the site. Did I get that right? So Bergen County tomorrow right here on campus at 8 a.m. and we'll go up until 350 tests. And then I think you'll be back at it, as we promised, 7 days a week. So they'll be back at it on Sunday. And then we will be up and running, unless you hear otherwise, at 8 a.m. at the PNC Bank Arts Center parking lot in Homedale, New Jersey, in our home county of Monmouth, Monday morning, March 23rd, 8 a.m. Today, we learned of 155 additional positive tests. That brings our statewide total to 890. We have sadly learned of 2 additional deaths as well. God rest their souls. Those families are in our prayers. That brings our total fatalities to 11. Judy will go through each to give some color on the positive tests as well as the fatalities. And again, God rest their souls. We think just because of the timing and the batching and the commercial lab leadership can address this. Our gut tells us that the 155 is light relative to what we will have learned by the end of the day. And the extent to which we learn anything that is meaningful on that front will come at you in some sort of a paper release. Otherwise, we'll be doing what we have been doing. We'll have press availabilities both tomorrow and Sunday. I mentioned earlier that we are almost certainly going to tighten the screws on social distancing. If we do that, it's likely tomorrow, effective for tomorrow night. And if we in turn do that, I think we will probably have an in-person gathering up north here somewhere tomorrow to go through exactly what we're doing. So bear with us on that front. The number, again, remember everybody, the number of positive tests is rising in part because, in fact, in large part, because of expanding capabilities from private labs, and we'll hear from some of them. We expected these numbers, and we expect them to keep rising in the short term as greater testing capabilities, such as the drive-through site here at Bergen County College, come online. And again, you've got the combination, and Judy and team can get into this in more detail. You've got an obvious combination. You've got some amount of community spread, and you've got an explosion in the testing regime. The numbers are going up. The numbers will go into the many thousands. We've been predicting that for some time. Just remember that. And this is not necessarily, on its surface, a bad thing. The more information we have, the better we will be able to respond to this crisis. So as we slowly but surely catch up with the testing, and again, I can't thank our partners enough who are with us on the dais today, including at the Department of Health, in addition to the private sector players. The numbers are going up, just know that. But again, that gives us also some ability to even better and more proactively manage the challenge. Earlier today, I signed legislation that builds on the steps that we've already taken to ensure that all coronavirus testing will be done free of any insurance copays to those being tested. And I thank again the legislature for their action. Both sides of the aisle, beginning with the leadership, beginning with the Senate President and Speaker, I can't thank them enough. Also, we are ensuring that anyone without insurance does not have to pay for a test. Cost will not be a barrier for anyone. Again, expanding testing is absolutely critical for a couple of reasons. First, of course, people may be exhibiting signs of COVID-19 or who may have been exposed in any way to a known case need to be tested. So clearly there is a need. Increasing our ability to get these residents tested is critical to saving lives. Second, as I mentioned, the more testing we implement, the better we will be able to track the scope of the spread of coronavirus, which will allow us to take even more focused action to flatten the curve and mitigate further spread. The data the testing provides us is critical to our response. And today, I want to again thank the gentlemen who are with us today. I am very pleased to announce that in partnership with both BioReference and LabCorp, we will be able to greatly increase our daily statewide testing capacity. And I'm equally proud that these are both New Jersey companies. I'll ask John and Bill to speak to their individual efforts in a few minutes, but make no mistake, this is a game changer in our overall efforts. Lab capacity is no longer an issue in New Jersey as it is nationwide. Our focus can now move to increasing specimen collection statewide. This greatly moves us forward. And again, to repeat an obvious point, as a non-medical expert, we too often talk about testing and conflate what is in fact a front end and a back end process. The collection of the specimen, the testing in the lab at the back end. Additionally, the state public health and environmental lab, and Dr. Kieran, thank you for being here, is getting the equipment it needs to increase its capabilities up to 1,000 tests a day, and is also developing test kit components to relieve shortages elsewhere throughout our system. So again, to both John and Bill, I thank you for your partnership and willingness to step up at this time. And in fact, I extend these thanks to all of our private sector partners. We cannot thank you and the women and men in your operations enough. Throughout the state, additional testing facilities are coming online. As they do, they will be announced publicly. But again, we urge those who feel healthy to take a step back and allow those either exhibiting symptoms or those who are most at risk to go to the head of the lines. Separately, under legislation I have signed, the Attorney General's Office through the Division of Consumer Affairs has temporarily waived restrictions to allow healthcare professionals licensed elsewhere to assist in our efforts here in New Jersey, especially in the area, not limited to, but especially in the area of telehealth. For some, that means doctors licensed in other states being able to provide telehealth services to our residents, and in accordance with the bill I signed, which I mentioned earlier, all copays for telehealth are also being waived. It also means that we can have the healthcare staff of the New Jersey National Guard step in to directly assist us as well. And again, I want to give General Beal a huge shout out to him and the men and women of the Guard. Finally, we continue to pursue every avenue to bring more personal protective gear into our state to backfill the normal supply chains. The state is working with the federal government to secure more from the Strategic National Stockpile, and we have placed significant orders ourselves, and we are working with private industry. Again, I want to give private industry a big shout out. I've mentioned a couple of the players who have stepped up earlier in the week. To that end, I'm proud to announce that Home Depot will be donating a significant number of N95 masks to for our public health workers' needs. We are extremely grateful to them. All of these actions, greater testing and more medical personnel on the ground, will significantly improve our response capabilities going forward. And again, I want to reiterate, as testing expands, the number of positive cases will grow significantly. This is not and it will not be a surprise. And I urge residents to not let these numbers increase the anxiety they already feel. I know it may seem counterintuitive. In fact, the more folks we test, the better we are able to reduce the anxiety. This information is vital to us in our abilities to flatten the curve. It is critical for us to do the things we need to do to keep more residents safe. So leave the anxiety and the worrying to us up here at the table and our colleagues. Keep doing the smart things to protect your families, the basic stuff. Washing with soap and water, don't touch your face, cough and sneeze into your sleeve, stay home. Frankly, everybody should be staying home at this point, but we've been saying all along, if you don't feel well, stay home. Keep the social distancing. Do not gather underground. And again, we're going to, and it brings me no joy, but we have no choice. We will, within the next 24 hours, further tighten the screws in terms of the social distancing. We have no choice. It is absolutely proven to be the best way we can get out ahead of this virus and crack the back of it. If you are not needed as part of our response efforts, stay home and again, practice social distancing and do all the hand hygiene and safe respiratory hygiene that we've talked about. We are going to get through this. I say that unequivocally, and we're going to get through it together. Again, not unscathed, not without mistakes or bumps in the road, but let there be no doubt we will get through this together, but it requires each one of the 9 million of us, the group of us up here and everybody around this state, to do their share, to do their part. And again, I would have a particular plea to beg you all for social distancing, particularly for our young people. Again, look at the pictures of the beach in Destin, Florida, or South Beach. Folks who behave as though they're invincible. First of all, the data is beginning to prove that young people may be a little bit more impacted by this than we had hoped. And secondly, more immediately, and we've said this before, you may unwittingly carry that virus and infect a member of a generation which is much more likely to suffer the more grave consequences of this virus. We can't allow that to happen. I had a terrific call with the Attorney General and Colonel Callahan, with chiefs, police chiefs, first responders, fire, union leadership, law enforcement up and down the state. And I said, thank you from the bottom of my heart for everything they do. Secondly, social distancing is job number one, and we're going to tighten the screws further. And thirdly, enforcing those measures is a huge part of making this social distancing and flattening of the curve a reality. I want to close with a word to all of the New Jerseyans who are out there every day doing the jobs necessary to our response. From our extraordinary public health and safety personnel, to our grocery store workers, to the folks at motor vehicles making sure that our trucking industry can keep supplies rolling, to the child care workers looking after the kids, all of the above, and to everyone else on the front lines with us. We need you in this more than ever before. You are doing the work that is mission critical to our state's response and recovery. We are going to come out of this together, stronger than ever before. God bless you all, and thank you from the bottom of my heart. With that, please help me welcome the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. Yesterday, I spoke about steps we've taken to protect our most vulnerable populations, our residents in our long-term care facilities. Today, we're putting in place another measure to protect our older adults. Today, we are halting adult day health care centers in all of our counties. For those who are not familiar with this service, adult day care is a program that provides social, health, and personal care services to older adults who need supervision during the day. The halting of adult medical day care is necessary to protect residents from serious and life-threatening risk of contracting COVID-19. It is also another measure to mitigate the spread of this illness. Earlier in the week, we closed the services in Bergen, Middlesex, and Monmouth because of the large numbers of confirmed COVID cases in those counties. With increasing cases across the state, we felt it was another important step to make. The CDC data has demonstrated the increased risk of serious complications and death for those over 65. In the United States, 80% of the deaths are among this population, and the highest percentage of severe outcomes are among persons aged 85 and older. That is why it's critical that we place these restrictions on programs and services targeted for this population. All residents, however, need to take steps to protect not only their health, but also the health of their loved ones. Stay home as much as possible. Practice good health habits. We keep repeating, wash your hands. Practice good respiratory etiquette. Social distancing. It's vital to slowing the spread of COVID-19. We must all take this seriously. As the governor said, I'm sure you've all seen the coverage excuse me, of young people at the beaches enjoying spring break. It's vital that our younger individuals take this illness seriously. You may not feel sick, but it's possible that you could transmit COVID-19 to someone who is more vulnerable. We are definitely all in this together, and we must take these steps together. As the governor said, today we're announcing 155 new cases for a total of 890 cases in the state. Sadly, today we are reporting 2 more deaths. One is a male in his 30s from Essex County. The other is a male in his 50s from Bergen County. We have 11 deaths in our state. 9 of those individuals have had comorbid conditions. 2 are still under investigation. 7 are male, 4 are females. 4 are associated with a long-term care facility in our state. We're thinking of the families of each and every one of the individuals during this difficult time. Our thoughts and prayers are certainly with all of the families that are dealing with this. The county breakdown of the new cases are thus: Bergen, 48, Burlington, 2, Essex, 8, Hudson, 9, Hunterdon, 2, Mercer, 3, Middlesex, 11, Monmouth, 10, Morris, 4, Ocean, 15, Passaic, 12, Somerset, 4, Sussex, 1, and Union, 9. There are 17 cases we're still gathering more information on. And as I've said, we will see more cases in the coming weeks, a lot more cases. And as we see more cases, especially among nursing home residents and those with underlying medical conditions, the stresses on our healthcare system will build exponentially. I'm very concerned about that. And that's why we're continuing to explore unused space in hospitals and long-term care facilities, and to look at standing up new hospitals I want to make it clear, we expect increases in cases. We expect a surge in cases that will stress the healthcare system significantly. This morning with the Army Corps, we did a walkthrough of a hospital in Woodbury in Spira, and I'm pleased to report that they have assessed that hospital to be up and ready right after we do a thorough cleaning and decontamination. The physical plant is in very good shape. So we do expect that that hospital will be ready to go and be on standby within 3 weeks, 3 to 4 weeks, 4 weeks the longest.
Judy, how many beds again?
300. We are also looking at a facility that used to be a hospital in Plainfield, New Jersey. It is now over 100,000 square feet of gutted interior, 48,000 square feet per floor. And the Corps will be looking at that tomorrow, and we expect that we can bring that up. That'll be fitted out, and we could bring that up in another 4 to 5 weeks. That will give us probably another 200 beds. So we'll have 500 beds of capacity, unused and ready to go when the surge occurs. Notice I didn't say if the surge occurs. We don't know exactly where the peak of that bell-shaped curve is, but we know it will happen. We're doing some predictive modeling right now to determine other areas in the state where we have to be prepared for critical care beds and additional medical, surgical, inpatient acute care capacity. We're also looking at closed wings at hospitals. There will be a complete review. We have about 7 or 8 that have come forth. And in addition to the closed wings, which we'll be able to bring up fairly quickly, we are looking at bolt-on wings that the Corps would build on the campuses of some existing hospitals. We're not only focusing on the Northeast, we are somewhat concerned of capacity in the southern part of the state. Even though the population is much smaller, we have fewer hospitals, and as a result, we need to be able to get capacity to handle any surge in the cities in the south. As you know, today, Bergen County Test Site opened. I want to give a shout out to the volunteers and primarily the healthcare workers, the nurses that came together and put that site up in very short notice. And it's not an easy task. Chris Neuwirth from Department of Health and the colonel did a yeoman's job, and it worked. People got tested, over 600 people got tested, and it will continue till there's no other people to test. And hopefully that will come sooner than later. Just a reminder, if you had mild symptoms, stay home and self-isolate. Separate yourself from other people in your home. Avoid sharing household items like dishes, utensils, and towels. And if your symptoms worsen, seek medical care, but call first. These steps can help protect you and your family from the spread of COVID-19. Thank you.
Judy, thank you for everything in your leadership. 2 comments and a question. First, the question. The 2 fatalities from yesterday, did they have adjacent health issues? I know you said 9 of the 11. Does that include the 2 from yesterday?
Yeah, 1 did, and 1 is still unknown. 1's under review. But what we are finding is that most of the individuals, no matter the age, and I'm going to give a shout out for general health here. Diabetes is in almost every single individual. Hypertension, cardiovascular disease, obesity. So please, that's a shout out for taking care of yourself generally.
Yeah, I mean, this is the point I was going to make. It's 9 out of 11. You know, is it going to stay at that hit rate in terms of, God willing, the denominator doesn't go up a whole lot more? My fear is that it will go up for sure. But that's the point I was going to make. Just generally, there's an adjacency and an overwhelmingly high percentage of this. 2 quick comments. One is, if my math is right, one of the unknowns is now in Cumberland County, meaning Salem County is now the only of our 21 counties that doesn't have a confirmed case. And Judy is still working through 94 unknowns, so there's a chance one of them is from Salem. So that's just to give you a sense. while the numbers are the biggest by far, and Bergen in the north is more impacted right now than the south, we take the entirety of the state deadly seriously. And when you look at, in particular, as Judy mentioned, hospitals per capita, we're exposed more than we'd like in the south. My other comment is, I haven't had a chance to look at it, but I believe this is true, that this is a bunch of information if folks need to know where to text or know where to call. Am I right? So make sure folks commit this to memory, because these are the best places to go for information. Judy, I can't thank you enough to you and your team. I'm sure we'll hear from you during questions. It's now my honor to introduce the guy who runs this county. And again, this county right now has 249 confirmed cases, and that's almost certainly understating meaningfully the reality. I can't thank you. He's a dear friend. He's a terrific leader. Please help me welcome the County Executive, Jim Tedesco.
I sit here today to have to say my thoughts and prayers are to our fourth Bergen County family member that isn't with us today. And it's close to home for me. Governor, I can't thank you enough for coming here today to be with us. And I can't thank you enough for getting the FEMA test site here in Bergen County, where we are feeling the pain and the suffering of this deadly virus. Governor, I have a tool belt on and screwdrivers in my tool belt to screw down and making sure that people stay home. I'm here to be with you. I'm here to work with you. I'll give you all the screwdrivers you need to keep turning that screw down. I want to thank the New Jersey Department of Health. Commissioner Chris, your staff have been outstanding in helping us through this and even helping us get this site up and running. I can't thank you. I can't thank you enough. To the members of FEMA, thank you for being here. Thank you for putting boots on the ground to help us here where it's needed the most. To the Colonel, thank you so much. Thank you for the National Guard. Thank you for having your folks here helping us through. Truly appreciate it, Colonel. To the other Colonel, Superintendent of the New Jersey State Police, I've known Colonel Callahan for some time, and I can't thank him enough for having the support and the folks here to help us as we navigate through this. And I know that he'll be here with us throughout this entire process. To the EMS folks, and Governor, I hope you don't mind that mine's going to be more thank yous. No. I just hope the EMS folks, they've been stand up. Without them, we wouldn't be where we are today. So I really have to give a big shout out to the EMS folks. To the Bergen County Sheriff's Department, the Bergen County Health Department, they're on the front lines as I sit here today. They're the ones on the front lines dealing with this. We have the virus in our law enforcement community, both at the county level and the local level. So we're going to be facing some challenges very quickly in our law enforcement community. To the folks here at Bergen Community College, under the direction of Acting President Dr. Tony Ross, thank you. I had promised them that we wouldn't use the building. I had promised them when I said we'll set it up at the college, we wouldn't use the building. Well,
so much for that.
Yeah, Dr. Ross and Larry Avanka, thank you so much for allowing us to use the building. I have to give two big shout outs, because we wouldn't be here today testing all these people without two groups. First, my OEM coordinator and my OEM Bergen County team under the direction of Sergeant Matt Tiedemann, who's standing right over here. He built the village, and they came. His model, I believe, will be the model that's used across this state. And if it wasn't for him and his dedication to this county, we wouldn't be here testing 600 people. So Matt, one hell of a job. Also to the DPW workers and general service workers and everyone else that helped Matt put this together, thank you, thank you, thank you. And now to the other shout out, to the volunteers. To the volunteers that came here today, that came here yesterday, that came here the day before to help us build this village. It shows you what this county is made of. It shows you what the state is made of. The fiber that the people have of this state and this county. To volunteer their time to come and help those in a time of need. Those people are the real heroes. They are the ones, they didn't have to come here. They said, I will come here. And they're making a difference. I gotta say thank you. I gotta give them the shout out. There were some today that I talked to, and I went around the entire complex today thanking every one of them. But I ran into a group of nurses, and they said to me, last night we got the call at 10 o'clock to come here. 10 o'clock last night, they got the call to come here. And sure enough, when I got here this morning in the dark, with the eerie feeling, with the fog, they were here. That's just truly remarkable. The people of New Jersey must stay home. I keep saying it, and I'm going to continue to say it. They have to stay home. The only reason people should be going out is if they have a critical need. That's it. Only that. If they do that, we will slow this down. The other part of this puzzle is the testing. It's so vitally important. And today, we took the first steps down that path of testing those that need it. If you don't have to go out, I ask you, shelter at home. Spend time with your family. Spend time at home. Because these are the two important aspects of what we need done. Staying home and getting testing done. Let me just give you a couple things that are happening here. Last night, at 10 o'clock at night, I received a call from one of the CEOs of our hospitals asking me what I could do to help get hospital beds. Not only do we need hospital rooms, they need hospital beds. What I could do as the county executive to get PPE. This is what we're facing here in Bergen County. We don't want our health system to collapse. We want to keep it up. We need to. That's the front. That's how we're fighting this battle. So to my federal partners, to the governor's federal partners, we need some PPE. We need things to keep us going here. Today, you heard the numbers of Bergen County, and I know the governor and Judy said that those are probably low. I will tell you they are very low compared to what I have in my numbers at Bergen County. Today, 56 out of the 70 communities now have at least one positive test. 56 out of 70. And our medical examiner's office has people in it right now that we're waiting for results so that we could tell their loved ones and we can let those bodies release to their loved ones. This is what we're facing. This is why it's so important that we work together, that we partner together. The governor, myself, all the folks work together because we gotta slow this down. With everybody's help, we will. We all gotta be rowing together. But here in Bergen County, we're feeling the pain. And Governor, again, I can't thank you enough for how much you've done to help us here in Bergen County, and I truly appreciate it. Thank you, Governor.
Thanks, man. Jim, thank you. And again, right back at you. Thank you for everything you're doing. You all have been the hardest hit by a multiple, by the way. Whether the numbers are understated or not, and again, I think the 155, I think Judy agrees with me, the 155 we got today is meaningfully understated just because of the way the batching is working. But even if you take the numbers on their face, Bergen is 3 times the next number of cases of any other New Jersey county. So we're here for you, and we ain't going anywhere.
Thank you,
Bless
Governor.
you. And please, apologize to the leadership of the community college that we went back on your word. It's probably my fault for
Yeah, that's all right.
dragging you into this room today. With that, again, Jim can't do his job. I can't do my job. Judy can't do hers without extraordinary representation in Washington. We have the best delegation in the country. And when we talk about the big asks of PPE, boots on the ground to do things like build out more hospital capacity, and the big bucket of money, repeat, direct cash assistance, we think, into New Jersey, New York, Pennsylvania, Connecticut alone, in order for us to allow to continue to serve those workers and businesses and communities in such need. $100 billion. I don't know where we would be without leadership. And the guy who is constantly there, and I literally speak to him all the time, always with an attitude of put me in, coach, what do you need, what are the asks, what can I do? There's nobody better. Please help me welcome Congressman Josh Gottheimer.
Thank you very much, Governor, and message well received on the resources. And thank you for your really incredible leadership. And it's amazing how much you're doing, given all you're dealing with personally, and it's as if you've put it all aside to take care of everybody else. So thank you so much for what you're doing, really. I can't thank you enough, and we all feel that way. County Executive, thank you for all you do in the largest county in the state of New Jersey, 1 million people, and it's incredible, and I'm so lucky to have you as a partner here every single day, and the college, thank you so much. Colonel, thank you, and the National Guard, thank you for all you're doing, and the New Jersey Director of Homeland Security, who just does such a phenomenal job and is always a great partner. FEMA, thank you for being here and stepping up so quickly to help our community. Our frontline healthcare workers, I know many of are here outside, and our first responders, our firefighters, EMS, law enforcement, always putting other people ahead of themselves and their own interests, and I just can't thank them enough. And I know we're in a place of education, so I do want to thank all the teachers in New Jersey, because I know they're having to reorient in this new equation, and our superintendent of Bergen County has done a phenomenal job. We're all parents, I want to thank you, because we're all homeschooling suddenly, those who haven't before, and I was doing long division, and I haven't done that in years this morning, and so my 10-year-old and I were battling it out, and she was right in her problem, I was wrong. I do want to start by just saying we have 2 major health challenges, and the governor outlined these perfectly, and so did the commissioner. And Commissioner, you're just doing remarkable work. Thank you. And Chris, thank you too. Separate from our economic threat that we're facing and that we're in the middle of. One, and this I think is pretty clear, as you've said, Governor, one, we must expand testing and improve processing time. And this is essential. We're all hearing it, but so we've got to stop New Jersey residents who may have the virus from spreading it. We've got to get people tested so they can get the help, but we've got to slow the spread. So people who need it, and because we only have, as you know, limited supplies, people who need it, and we must get tested. And the center here that we've set up, and the camp set up here is incredible, Jimmy, what you guys have done and in a short period of time with FEMA and this new testing site, and then the new one that, Governor, you announced today they're adding on. This is what has to happen across our state, and as you said, only people who need it, talk to their doctors, come here, because we've got a long line of people I know who want to get tested, but we've got to make sure only those who really need to get tested. And as you know, you did it in the state, Governor, but we did it federally in our legislation that was signed into law 2 days ago by the President, passed out of the House and the Senate, testing free for all Americans, right? So even if you don't have health care coverage, you can get tested. If you need it, please get tested. 2, and you made this point about PPE and supplies. We are woefully behind on equipment, supplies, goggles, masks, surgical masks, N95 masks, and these are for our frontline first responders and our frontline medical professionals. They need them because they're actually testing. They're in our hospitals. We need to keep them healthy. I think this is really, really important. And listen, and Governor, I know you've been in touch with everybody under the sun. There's not a single person you haven't spoken to get them. I'm doing the same thing. We called up dentists. We called up surgical centers. Obviously, we've all spoken to the White House and to get more from the strategic reserves. But we've got to get this gear into greater production. It's going to take time, but in the meantime, we're looking talking to everybody around the world to try to get more supplies. Our hospitals are in such, especially here in Bergen, where we have the greatest number of cases, we have to be able to get more gear, and I want to thank industry also for stepping up. Just this morning, one of the care centers called and said, I've got 2 boxes of 600 surgical masks, do you want them? And we got them sent to a hospital within an hour who needs them. That's the kind of way people are coming together right now, and it's the way our country should operate every day. But, it's unfortunate it takes a crisis to bring us together like this, but I think we're all learning that this is how our country should operate. People coming together, putting the needs of Americans and each other and families first and foremost. Now, as we continue to tackle the health crisis, I just want to make one point about the economic crisis. And Governor, this I think addresses part of what you're talking about. We've got so many people now, and we're all hearing from them, and we know them, and they're our friends and our family, that especially hourly workers and who have no income. And the state is doing an incredible job getting people who need it onto unemployment insurance. We've sped that up federally and allowed to knock out some of the barriers to getting signed up. That's very important, and we got to increase, and I'm arguing we got to increase the amount people are getting. We've got to get money to people's checking accounts immediately so they can get food. I help co-chair this group called the Problem Solvers Caucus. It's 24 Democrats and 24 Republicans in Congress. We put out a plan yesterday that we voted on and we supported. About more than 10% of Congress coming together and it's the Health Crisis and Economic Revival Package. First and foremost, it includes getting for salary workers who are out of work, of course, of certain income levels, and for hourly workers and gig workers, getting those resources to people, because we need to get those resources to people. We also need to make sure that if you're unable to pay your rent, if you're an individual, if you're a business, we've got to give time for that, for people to pay their rent, pay their mortgages, pay their bills, right? We've all got to come together on this, because it's critically important that we give people more time to pay their bills. We also have to give our businesses, especially small and medium-sized businesses, and I'm going to be arguing strongly for this, long-term, low or zero-interest loans, so that they can stay afloat, and they've got to commit to keeping their workers or to furloughing their workers so they get benefits. We've got to make sure that businesses can stay up. I've spoken to so many restaurant owners in the last day, and bar owners, and so many businesses that right now there's no one coming, and they got to keep their doors open. We've got to help them, so when we get through this, they can stand back up and be there. It's really important. It's the backbone of our economy. As we know, small businesses are half the jobs in Jersey. They're 8% of the actual business in New Jersey are small businesses. We've got to make sure they're okay. Obviously, we've got to make sure our airlines are there and our other core vital industries, but we've got to take care of our small and medium-sized businesses. 2 other quick points of things we argued for in a bipartisan way. Supply chain issues, it's going to continue to be an issue with our supply chain. So I know our grocers are doing incredible jobs getting the food out to people. We need additional regulatory relief at the FDA and CDC to allow for more market-based testing solutions and supplies and testing kits and ventilators, because as you know, we have a huge shortage of ventilators and obviously personal protective equipment. The military has offered more resources. I know the governor has requested a portion of that for here. I think that's incredibly important. They have ventilators. They've offered up a lot of equipment. We need to get that to New Jersey, given how hard and we've been hit. Last point I just want to make before turning it back over. I really ask everyone to work together on this, on the loan deferment and forbearance that I mentioned before, whether you're talking about student loans, which the president announced today that we're going to allow deferred that for 60 days. The IRS announced that they, both for filing and for collection, a 90-day delay. That's going to be obviously allow people to have more cash in their pockets, but also people just aren't at work to be able to prepare their taxes. We got to give people relief on these fronts as much as possible to deal with this process. And as the governor said, we'll get through it. We need to be ready on the other side of it to stand our economy right back up and to be prepared. But it's really only if we come together and look out for each other. And we will fight incredibly hard for resources back to New Jersey. It's essential. We're talking to the whole delegation about it, our members of Congress, both parties, our senators. We are going to fight to make sure New Jersey is able to keep moving on. there's a huge amount of pressure on the state right now, an enormous amount of pressure. We have to do our job in Washington, and I'm hoping we're going to vote as late as next week on a package that will include more significant resources back to the state of New Jersey to do whatever you need. Governor, whatever you need, you know that the line is open. Please, we're here for you. Anything you need whatsoever. This virus does not see gender, religion, race, or political party. Right? And we are truly all in this together. We are the greatest country in the world. We will get through this stronger on the other side. So let's all stay healthy and stay safe and practice all the things the Commissioner tells us to do to stay healthy. So thank you and God bless.
Josh, thank you. So well said, and cannot thank you enough for your fierce advocacy for our state, not just your district, which is we're right smack in the middle of it, but for our entire state. I cannot thank you enough. And again, your attitude is just tell me what you need, man, and that's as good as it gets. So thank you. Bless you. It takes a village, as they say. No matter how good Jim might be, or we might be, or Josh, or Judy, or any of us, boy, it really matters when we can surge and include really distinguished private sector leadership. And there are great examples up and down this state right now. You see it. It screams through at a time of crisis and challenge. And boy, is it doing that right now. We've got two really distinguished leaders of outstanding Jersey organizations with us today. I wondered if I could begin by asking Bill Haas, the Senior Vice President, Northeast Division of LabCorp, which is one of the existential, along with BioReference and Quest, who's not with us today. These are the companies, I don't know where we'd be without them, who are doing the big scale, rapid testing for folks for the coronavirus. So Bill Haas, a few words from you. And again, it's great to have you with us, and I can't thank you enough for your partnership.
Thank you, Governor. LabCorp is working 24 hours a day, 7 days a week to perform tests and increase the number of tests we can run. Our utmost concern is for the safety of the public, our patients, our healthcare service providers, and our incredible LabCorp employees. As of today, we can perform more than 20,000 COVID-19 tests per day for patients across the U.S. That's a significant increase in our capacity since we first started testing just 2 weeks ago. We are not collecting specimens for COVID-19 testing at our locations, but we are now dedicating the first hour of service each day at our patient service center locations for the other testing needs of the elderly and the most vulnerable. In New Jersey, we are proud to be working with Governor Murphy and the other state officials to support the public response. We began performing COVID-19 testing at our lab in Raritan, New Jersey earlier this week, and we are doing everything we can to keep people healthy and support the public response to COVID-19. I'm deeply proud of my LabCorp colleagues around the world, across the U.S., and the thousands right here in New Jersey. They are working so hard to respond, and we should all, as the governor and others have noted, give a big thanks to all those who are on the front line of healthcare. But this is not just about LabCorp. We are working closely with the government and others to increase the test capacity and to respond to this public health crisis. And we're proud to play an important role as part of an industry consortium that is committed to meeting the growing demand for national testing. Thank you.
Bill, thanks to you again and your colleagues. Let me ask you a question. You said you're up to 20,000 a day, and that's a big increase from 2 weeks ago. Just out of curiosity for folks, where were you 2 weeks ago?
We validated the test 2 weeks ago.
So
It is an enormous increase in our capacity.
you put the first brick on the ground 2 weeks ago.
The first test went through 2 weeks ago.
That's extraordinary. Bill, thank you. Cannot thank you enough. John Cohen is the executive chairman of BioReference, another great private sector actor who has just stepped up in a big way. I know that they are actively forming ventures with a handful of our counties to expand testing and specimen intake up and down the state. John, it's great to have you with us. Would love to get a few words from you as well, sir.
Thank you, Governor. And I just want to mention, as a practicing surgeon for 20 years before I took a different turn, looking at you today, New Jersey is very fortunate. The vigor that you have now and the way you look now is absolutely terrific for a guy who'd had this surgery done recently. So congratulations on that. As you know, BioReference is actually headquartered here in Bergen County. We're about 4 miles from here. We have worked 24/7. Our employees literally working 24/7 to get the tests up and running. We have many of our employees who actually live in Bergen County. 3,000 plus of our 4,000 employees are employees of the state of New Jersey. And many of our employees' children go to this college. So it's particularly meaningful to us that we're able to help you and the state. As you mentioned, we announced this morning we've established agreements with 5 of the counties, with more to come. We've established official agreements with Union County, Ocean County, Essex County, Burlington County, and Hudson County, and we'll begin testing with them through their drive-through facilities within the next week or so. We are also, like Bill said, we have ramped up to about 20,001. I'm only kidding. We're doing about 20,000 a day, as he is.
Friendly competition there by any chances there?
We are prioritizing. We have several of the large health systems who are sending us their criticals. And those are patients that are in the hospital. Those patients particularly need turnaround times within a very short period of time to help the frontline employees, the physicians, the nurses, the medical workers, to make sure that they can make the diagnosis as soon as possible, because it does have an impact on the therapy and how they treat those patients. I also want to comment that we're beginning to look at testing for first responders, the police, the fire, EMT, and beginning to work through a process for how do we get those people screened. And finally, the demand is enormous. We like Bill, we serve all 50 states. We have labs in California, Texas, Maryland, Florida, but our largest laboratory where we are currently doing all of the national testing is 4 miles away. Sitting here in New Jersey. So I want to thank, again, everybody that's been mentioned, but particularly, again, the governor and the folks that work for him and the commissioner staff for the leadership that they have portrayed to get us to the point that we are today.
John, thank you. And I appreciate your personal comments. I need to be referring to as, more appropriately, Dr. John Cohen. So thank you for that. By the way, elective surgeries, I'll give you a personal example. My surgeon needed to see me for a post-op checkup, and we decided to do it via iPhone. And he gave me the thumbs up. So far, so good. But he made the point as urgent as my surgery was, urgent within a period of time, that there was no way that I would have 2 weeks later been able to keep that schedule, that they would have put me off. He hoped not for long, but that's what we're dealing with right now. Judy knows this better than anyone. So, Bill and John, I can't thank you enough for your help. We're going to go to questions. We've got on the one end, we've got Tom Kieran here. We've also got Chris Neuwirth and Pat Callahan, Jared Maples. National Guard are here if we've got any questions, but I think we will not have any more formal comments, and we'll go to questions. And I yesterday started right to left. I apologize. We're going to go left to right here. So I assume my wife does not have any questions, so we'll go to you, please. Dante, you here?
Yes, I am. It doesn't seem to be working right now.
The live stream?
No, the question microphone.
No problem. Do you still have one for the live stream, or
Yeah, you guys are still going.
how about the questions though?
No, it's not.
Okay. Sorry for that.
Okay. Just a couple questions, if I could. One about the 2 men who died in their 30s. Do you have precise ages or the 2 men who died in their 30s, do you have precise ages for them and their pre-existing conditions, if any? And then the other question I wanted to ask you, Governor, that we're getting a lot from some of our viewers and such is there seems to be confusion in the construction industry. Specifically, you have hundreds of workers still working at American Dream, even though the mall itself is closed, and workers have brought us their concerns about that because the sanitary workers in that facility are gone. But then you have small-scale construction sites in the state that have been brought to a complete standstill
Yep.
because building departments are shutting down, not doing permits and inspections. I wonder if whatever you're going to be announcing tomorrow will provide more clarity on that, or if you can do that today.
Anything else? You good with those two? No. You reserve the right. On the latter, we will provide more clarity, period. So we are putting together, and I know Judy will talk about the two cases, but I will give another health warning that I think we give every day, that we're only going to go so far as it relates to individual cases, but I think Judy can give some general comments on that. So just as it relates to the executive order that we're working on, as I said, I think right now our expectation is that we'll be having something by tomorrow. We want to do this right. So you may remember back when we were closing schools, even though a lot of districts got out ahead of us, we wanted to make sure we got that exactly right, particularly for food insecurity, for daycare, for remote learning. We want to get this right. So when you talk about closing, which we will, you'll hear it here first, non-essential businesses are going to be shut down. Gatherings of any sort, I'm not sure if we're going to be to 10 people or we're going to 0 and just eliminate any gatherings. Those are the sorts of steps we're looking at. But we don't want to do this just to get a sugar high. We want to do this with teeth and with the right substance. And we don't want to use a different angle. I don't want to turn on CNN and look at some waterfront in New Jersey that looks like the waterfront in San Francisco as it looked last night, even though they had this shelter in place. You had literally, I don't know if you watched the B-roll, but you had people literally by the hundreds of jogging, going shopping, holding hands and whatever. As Jim said, enough. So we want to get this exactly right. So there's sort of two ways to do that. One is you're very open-ended and allow folks to interpret what you mean by essential and non-essential. California has been more open-ended in that respect. At the other end of the spectrum is very prescribed. Pennsylvania, for instance, is much more prescribed what they did last night. We want to get that balance right. And so I'll leave it there other than to say construction of all shapes and sizes is something that our folks are going through and considering as we speak as part of that. Judy, any comments you feel comfortable saying about the adjacent health issues and any other color on some of the fatalities?
Yeah, I think it's important to note that we do track as much, it's in summary form, pre-existing conditions, and cardiovascular disease and diabetes mellitus is coming up with almost every single person. For those two as well. 30 and 37.
So the 37 is the new one, right?
37 is the new one.
And the age of the other fatality overnight was 53?
52.
52. Thank you. Matt?
Governor, can I just clarify when you just said non-essential businesses are going to shut down? Did you say that will be part of the order, or it will be? It's not just on the table?
It's going to be part of the order, but but bear with me because I don't have a crisp definition. As I said, the reason I went through that preamble is we want to get that right.
Just a follow-up to that, out of curiosity, I mean, you said that you're working hand in glove with the the governors of New York, Connecticut. Is there any reason why everybody wasn't on the same page with this? Is that not?
Nope, no reason at all. In fact, if you look at the restrictions that we have in place, even though Dante, you may want to stay close because I know my friend Matt here may have a follow-on question. It'd be the first time. If you look at what we already have in place, frankly, it's ahead of most places that are now claiming shelter at home. So there's a lot of in-name only stuff. And by the way, there are differences in our states. So for instance, we're the state that came out first and we felt strongly about restricting any non-essential travel in the state between 8 p.m. and 5 a.m. No state in America had done that. Connecticut and New York have casinos that are run through the Native American communities, which makes them a little bit different. We called up our National Guard before any of the other neighboring states. In this case, Governor Cuomo and I were on the phone this morning, as we had been. He was very explicit where he wanted to go. I said we want to go in generally the same direction. His press conference happens to be a couple of hours every day before ours. But again, as it was when we closed public schools and private schools, we want to make sure we get this right. That it is not just to say, hey, gosh, we put a label on this and we should all feel good about it. This is tough. Again, it brings me no joy to say this. The only way we're going to beat this darn virus is if we literally stay home and stay away from each other. And we want to do everything we can to get that exactly right. And again, we'll come back to you. Mahan has given me, we're going to come back to you and let you know a little bit more details on exactly how we're going to, timing and how we'll let you know on that.
Thank you, and I appreciate it. Just a little bit of a lengthy one, but so we've been told that on Wednesday you held a call with hospital CEOs and nursing union leaders, and that on this call you directed the board chair of New Jersey Hospital Association and the president of the New Jersey Hospital Association to work with nurse unions to develop statewide guidelines on using personal protective equipment. However, we've also been hearing from folks that certain health systems may be ignoring that charge and establishing their own PPE usage guidelines. I'm curious, Governor, is this still your expectation that statewide PPE guidelines will be established consistent with your charge on Wednesday?
The first part of your statement is absolutely right. That's exactly what I said. I asked for a working group of both the working leadership of the healthcare workers along with the hospital association to get into I said get into a room, but I said I got to take that back because we're not allowing that to happen anymore, but get on a call and try to harmonize. I'm not necessarily, whether it's 100% consistent, I would like, but at least at harmony across our systems. As you can imagine, have been running 1,000 miles an hour. Judy may have more color on this. I know that everyone's hearts are in the right place. Everybody on that call expressed a genuine appetite and desire to achieve just that. I can't give you an exact status point as to where it stands right now across the systems.
To elaborate on that. I think what's happening right now is everybody is so anxious to make sure that we're protecting our healthcare workers, and appropriately so. I think what that short game is not addressing is what we have to address from where we sit, and that's the long game. Our concern is the availability of PPE over time. So when you talk about harmonizing short-term requirements with our long-term goal to have PPE available a month from now, 2 months from now, and maybe 3 months from now, we need to give guidance from the Department of Health and the Hospital Association and the individual hospitals and our home care facilities to try to preserve and just be very judicious in our use of PPE. People are concerned about healthcare workers, appropriately so, and we are also. There's a balance in there somewhere.
Judy was on the call with me, and actually was a very good call, I thought, because folks were able to get their points of view. We had surveyed folks on our own on a bilateral basis, and the issues that we heard consistently were training consistency, application of PPE across the board, clearly levels of anxiety, daycare, questions from the workforce side. Can we creatively redeploy folks from different walks of life that have some adjacencies? It was a good discussion. In fairness, it was at the end of the day on Wednesday. We're now early afternoon, I guess mid-afternoon on Friday. We will be going back at that and doing some follow-up. So thank you for that. Do you have anything, ma'am?
Yes.
Please.
What is the turnaround time for the tests? So the people who were tested today, when can they expect results? And second to that, the people who are unfortunately passing away from coronavirus, has there been any concern in funeral preparations? Is there any concern for contamination for funeral providers or funeral gatherings? I know you mentioned that yesterday. What are your thoughts on that, especially for the family in Freehold? I mean, that's a large family.
It is. I mean, I'll take the latter, and Bill or John or Judy can take the turnaround time. You know, my team deemed my answer far too charitable the other day when I said Pat Callahan and/or his colleagues aren't going to go in and break up a funeral. The fact of the matter is, Pat himself noted the other day that he is not going to a funeral, and of the mother of a fallen trooper. Not only is he not going, he had to discourage from any amount of folks being a part of that. I have a dear friend who just lost his daughter, a young girl, tragically. They are German. They are headed back to Germany, and the Federal Republic of Germany is enforcing a 10-person maximum. They're literally delaying. They're going to bury the poor little girl and do the funeral 6 months from now. So my guess is you may see some of that, particularly if we're going to go, almost certainly we're going to go down to something like either 10 people or no gatherings whatsoever. I have not been directly speaking with the Funeral Association. I think Mike Delamater on my team has been in touch with some of its members as well as the association. I don't want to overstate that, but I think they're taking the precautions. The more sad, realistic piece is the restriction on the amount of people gathering at one time. In terms of testing, how quick a turnaround, Bill?
So from pickup of specimen to resulting of the test, our objective is to get the result back in 3 to 4 days. With the surge in testing, obviously our labs, all of our labs across the United States are challenged to reach their objectives. We're doing everything we can to get down to that level. Yep.
Bill, thank you. John, would you be similar time frame? Tom, anything you want to add from the state side? You good? Okay. Please.
Yeah, I wanted to ask a school question. President Trump and Betsy DeVos today offered up waivers to states to suspend state testing this spring. Does New Jersey plan to apply for that waiver?
I did not see that from the president or the secretary, so forgive me for that. We have not made a decision, but if you...
Are you inclined to, with that offer?
To be determined. New news. By the way, am I wrong in saying that you weren't there and came back? Or did I skip you? I was there and came back. I apologize, okay. Pat, anything, now that because you've asked a couple of times, anything from the front in terms of update on food distribution to the kids who are food insecure?
I received the text from Commissioner Repollette about 2 minutes before I walked in here that the Department of Education teams are out there. And again, he indicate no issues to report just about an hour ago.
Thank you for that. Again, we've not forgotten the assessment question, and we will come back to it. We'll get something to report. Can I go? Will you permit me to go to Brenda, and then we'll come back to you, Jen? Thank you.
Hi, thank you so much. I'm sorry, John. Could you talk to about why you cut off testing at 600 today? I know that you had 2,500 kits available, and it sounds like you're going to be essentially taking a metered approach to this. Are you able to get more test kits? People were lined up. They had to get turned away because they thought testing was going till 4. So what's the word going forward in terms of how long people should wait? Should they? The line was down the road.
Yeah, I'm going to tee Chris Newworth up to give you the real answer, but sorry, Brenda's got a second question.
And what did you run out of, if anything?
Okay. Again, Chris can answer the specifics, but may I say this? We have a choice to be glass half empty or glass half full. The fact that we got 600 tests done on day 1 with the amount of demand is just extraordinary. So it's beyond any wildest dreams. Secondly, I believe we have 2,500 per week at the moment. So our hope is to be in business each day of the week. And so that's another reason why, and we got to get these things tested at the labs. Chris, would you add anything to that?
So make no mistake, today's test site was a success. We expected to test approximately 200 individuals, and today, preliminarily, we've tested 654. So by all measures, it was a success. Recognizing the space constraints of the operation and the ability to only store a certain amount of resources on site at any given moment, the resource constraints is why we drew the line at the 600 or so. We recognized yesterday when we shared this with you that we knew we would adjust accordingly as we moved forward. We now know that we will be storing additional resources on site to ensure that we can continue testing for all of those that need it who arrive. So again, as we move forward tomorrow into the coming days, we will ensure that the operation continues to be refined. But recognizing that, we will be taking a measured approach to ensure that it is as flawless of a process as possible, and we'll be cutting off that line at 350 specimens per day at this site.
So again, reiterate a huge shout out to the Guard who kept great order, not surprisingly, but guys, thank you so much. John Cohen, want to add something?
Just want to comment. And so first off, what Chris said is extremely correct as the governor. Having watched multiple of these drive-throughs stand up and run, 600 a day is quite a success in terms of what needs to be done at each one of these sites. That's number one. And number two, there's this, I'm going to call it misconception about what kits are. So I just want to make sure that I run through that with everybody. The patient gets scheduled, they come up and they get a swab taken of their nasal pharynx. What the swab is then put into a little vial of fluid. People are referring to that as a kit. It's the swab and the fluid. That is then packaged and brought to the laboratory and resulted. When you look back at the stories, there were all these stories about the CDC kit. So there was a huge amount of confusion. The CDC kit was actually a bunch of reagents, controls, primers that the CDC provided to actually give us the ability to run the test. So the issue is not right now the number of kits, meaning the swabs, although there's a lot of discussion at the federal level about will there be enough swabs. The second issue is the capacity to actually run the test. So when you factor in all of those issues, being able to run 600 in a drive-through is quite remarkable on the first day. There is an enormous amount of logistics that have to be done, the coordination of the medical staff, having people scheduled, getting it packaged, getting it refrigerated, getting it sent to the lab, and getting the result back.
John, I would also say this, again, we're not patting ourselves on the back because we make our share of mistakes, but not only would I underscore that, the amount of different organizations that were represented to make this test actually happen is jaw-dropping. And the fact that they were all able to come together and work as seamlessly as they did as a team is a huge credit to each and every one of the organizations. John, I apologize. I knew we'd get there.
Can you talk about the protective equipment? Is the state coordinating the distribution of whatever it gets among the hospital systems, or are the hospital systems on their own going out and buying from the various vendors? And then is the state also coordinating or gathering data about deaths and hospitalizations to prepare for the expected surge? And I have questions on the coming order. On the coming order tomorrow. Okay. Is this an enforceable, or is it a suggestion? Where there was confusion over a curfew versus a recommended?
Yeah. So I had used the word curfew last week, and it turns out it was a strong recommendation, just for largely legal reasons, to be determined. So if you could bear with me, but this is going to be, if I had to put a phrase on it, it's our way or the highway time. And that's what this is going to be. And again, I'm not trying to be mysterious. I just want to make sure as we're piecing this together, we get it right. Judy, would you mind talking about PPE? I think it's and both, right? It's both what you're doing and the hospital
systems. It's and both,
systems.
and I'm going to let Chris talk about the national stockpile and how we're controlling that with New Jersey Hospital Association. I'll go to the second question. Penn Medicine put out a predictive modeling tool, and we're working with the hospitals to populate that tool to be able to predict when we believe the surge is going to occur. So we're in the process of collecting data at this point. It won't be perfect, but I think it will give us an indication of when we have to get extra capacity online, and then what type of PPE we need to be able to handle that. And Chris, maybe you could talk about the warehousing and the work with NJHA and the prioritization.
So the Department of Health is incredibly fortunate to have such a strong relationship with the New Jersey Hospital Association. And throughout this entire event, the department has worked in lockstep with NJHA to ensure that both organizations have a comprehensive picture of what the status of PPE is across the entire healthcare spectrum. With that being said, it was evident early on, and it continues to be evident, that New Jersey needs more PPE. And we have submitted requests directly to our federal partners to request additional allocations from the Strategic National Stockpile. We have worked hand in hand with our congressional delegation to continue the fight to get SNS supplies released to New Jersey. And also, we're out there working with vendors and distributors to procure the PPE directly, using federal funds, that have been made available specifically for this purchase. So we're not putting our eggs in any one basket. We are looking across the entire spectrum of options to ensure, in any way, shape, or form, New Jersey will have the PPE it needs to ensure the care and public health infrastructure remains capable to deliver high-quality clinical care to those that need it.
Josh, do you want to weigh in?
I just want to add, yes, if you don't mind, Governor, I just want to add, part of this and why we fought for the first package, which was $8.3 billion of emergency funding, bipartisan, to help get those resources out. It also included resources for small businesses. And in the second package, food security and other pieces. But this issue that you're talking about is so essential that you have the resources that you need in the state to make sure to procure whatever it is you need to protect your frontline healthcare workers and our first responders, and of course, the tests and everything else. And that's going to be one of the things, we've all been speaking to each other in Congress about this. We've got to make sure you have the resources that you need to procure what you need to keep people safe. And so I just want you to know that it's incredibly, incredibly important to us.
It's quite striking, by the way. By the way, the White House has been unequivocal, and our relations have been very good, but they've been unequivocal in saying that they'll do their best, but you better do your best. And we've taken that advice, whether we like it or not, we've taken it to heart. You mentioned this earlier, Josh. The requests are strikingly similar from around the country, from governors of all shapes and sizes. And politics has at least at the first cut very little to do with it. It was quite striking on the video call yesterday what came up consistently. Block grants, or direct cash assistance as I'm calling it, in big numbers came up from red states and blue states across the board. I had mentioned that we had asked the petition the federal government to move Real ID back. We think they should move the census process back. That came up from states of all shapes and sizes. Personal protective equipment comes up across the board. So as challenging as this crisis is, and we will get through this unequivocally, as I've said many times, as challenging as this is, it is in a kind of a peculiar way brought us a lot closer together. And I hope that we learn lessons that never go away from that in particular. I'm going to do a real quick sweep just because we've got miles to go today. I'm going to go back from right to left. John, you get to start it. You good? Why should I offer up opportunities to ask questions my colleagues are asking?
The family in Freehold, there's a lot of attention, a lot of people, it's a heartbreaking story. Has there been another death related to that family? We were told there may have been one. And can you talk more about the possibility of delaying the United States Census? Is that a reality, or is that just a request?
On the former, I believe there are 4 deaths in that family, Judy, right? And I don't think we've got any more beyond that. And it's a tragedy. It's an awful, without any hesitation, without any qualification, a tragedy. I don't know is the answer on the census. It just seems to me, just as we made decisions yesterday as it relates to elections, just as we have requested that the Real ID timetable be pushed off, it seems logical, particularly in such an intense human-to-human process like a census, where you literally are trying to go, count every vote, count every person and go door to door. That seems to me on the list of things that wouldn't be a bad idea to push back. Would you agree?
No, I'd agree, and it's a constitutional requirement, of course, that we have a census.
Yeah, so-
But many of us are talking, and if there needs to be a legislative fix in terms of timing, and how the process works to make sure that we can accommodate the crisis we're in.
Yeah, it's not whether we'll do it or not, it's the timing, right?
Another school question. You've talked a lot about the food availability and that being the big challenge. It's been the first week of families being home, doing remote learning. Can you share a little more, if you've had conversations with the commissioner, about how the learning is going and the lessons here, as well as is there further consideration of closing for the rest of the year as some other states have done that?
We talk to the commissioner all the time, as you can imagine. The remote learning, for me at least, has been anecdotal, and it's been largely quite good. Anecdotal, begin in my own household. I've got 3 college kids and 1 high school kid. One of the college kids on spring break, so he's had the week off. The other 2 are remote, and our son is remote, and it's happening. I heard some really good comparisons of New Jersey's experience right now to other states, and a huge shout out to our educators. We have the best in the country, and they were prepared for this. And the anecdotal evidence, and I want to reiterate it's anecdotal, has been very strong. We've made no decision in terms of how long schools will be closed, but I would say, I don't want to make news here, but almost certainly they're going to be closed longer than whatever date we've given you, but to be determined. Please, did you have any?
Yes, I do. Firstly, to the LabCorp and BioReference, how many tests can be processed with one CDC test kit? Does that make sense? Like, you were saying the CDC test kits go to your facilities, and then how many samples can that process?
The CDC formula, recipe, whatever, is relatively slow. That's part of the issue. So the reason it is that, let me take you through the process a little bit. When you get the specimen, you actually have to extract the virus, the RNA virus. That extraction process for the CDC test is manual. You actually have to take the fluid out, pipette it under a hood, put it into a bunch of plates, and then put it onto the analyzer with a separate set of reagents. It's very slow. The result of that is you can do a couple hundred tests a day. What I'm sure Bill will confirm is what we've done is we moved to automated platforms. We moved away from the CDC test. So we're running multiple platforms that are automated. And what that means is now you take the little vial, you put it in the machine, and it runs it. So the CDC issue for us is a non-issue right now, unless we need to bring it up to run a couple hundred more tests a day.
Thank you. Real quick, please.
Yeah, Governor, you had mentioned your health, and it's great to see you're doing well and what have you.
This is the nice, slow reentry into my job that I had anticipated all along here.
Welcome back.
Yeah.
Baptism by fire.
0 to 90 in
Yeah, right.
3 seconds.
We've gotten some feedback from viewers that they're concerned, they're wondering, how is he doing it? Typically when someone has an operation, it's a slow reintroduction to work and things like that. How are you taking care of yourself to make sure you have the stamina?
Yeah, I got to be careful. I have to be careful. So I will admit to you that I'm the needle is at the red line. I mean, I've got to be very careful. So I've got to really manage how much time I'm by myself at home and work on the phones versus how much I'm out. This is a rare road trip other than going to my office. And I've got to manage that very, very, very carefully. So I appreciate your asking. So far, so good. I feel good. We had the checkup via Tammy's iPhone the other night. It was a good one. It was a real wake-up call, though. Again, I had something that had to be done within a certain amount of time. So this was not, I was not getting my nose done or something, right? So this had to be done within a certain amount of time. And even with that surgery, my surgeon said that it would have been, in all likelihood, pushed off. So, Brenda, you good?
I actually was kind of wondering, we had talked to some nurses, and I don't know if you saw the New York Times article regarding the personal protective gear. They're concerned that the masks, the N95s, are being rationed for the more invasive procedures. The CDC changed its protocols, and that now they're using surgical masks to do a lot of the patient care that had regularly been done with the N95s because of the scarcity, because of the shortage, and they're concerned. Is there something that you can offer? Have you spoken with any of the healthcare unions about this? Because they are concerned about their staff safety.
I will just say, as a general matter, we speak to the healthcare union leadership all the time, whether it's HPAE, Debbie White, Sue Cleary and her group, the whole range of folks, Millie Silva, and PPE and masks specifically come up as a regular, rightfully, by the way, is a regular concern and question. I read another article today in the New York Times about a cruise ship using napkins as a mask, which was shocking. But Judy, anything you want to add real quick?
We're asking all the hospitals to follow the CDC guidelines, and they are balancing that a bit. If you're giving direct patient care and it's not, you're not involved in an aerosolized procedure, you can use the regular mask, but we do and definitely give guidance. You follow CDC. They're following what's the progression of disease across the whole United States and the world, so they're able to balance without and still maintain precautions. And I know the flexibility in the PPE, and I was on a call before I came here, the difference hospital to hospital, that type of lack of standardization gives people a lot of anxiety, gives our healthcare workers a lot of anxiety. So we're trying to work with the Hospital Association and the hospitals and the unions so they understand what the bandwidth is. It doesn't have to be exactly the same, but the bandwidth is getting a little bit larger as we learn more.
That's the reason. In fact, Matt asked about that call the other night. That's the exact reason why we did that call. High on the list was PPE, masks obviously included. And again, I'd use the word harmonize as a reasonable objective, as opposed to necessarily, although we'd like to standardize. But the other message is, let there be no doubt about it, and I think we've been crystal clear about this from the moment we started doing this, we don't have enough. We just don't have enough right now. We're the number 4 state in the nation in total positives. And we're only behind New York, California, and Washington. We do not have enough PPE, and we're doing everything we can, literally turning every single stone over to get that. So in addition to how we use what we have and the harmonization, if not standardization, and to making sure that we're adhering to the CDC guidelines, we need more of it. Matt?
Governor, so I understand that this is an easy one probably to punt on because we don't know what we don't know, but Governor Cuomo had said in a recent interview that he thought the apex in New York they're 45 days out from it. That was a few days ago. I mean, do you have, speaking with health officials, do you have any sense of where we are right now of when we might hit that apex or where we are in this?
It is easy to punt, so I kind of will punt it, but I'm not being blithe when I punt it. And I'm surrounded by healthcare experts, so I'm not sure I'm the right guy to be asking this. But based on every amount of input we have, we are many weeks away. And again, if we can crack the back of the curve, and really not just. And again, I think we've been aggressive. Other states can call what they're doing with some fancy headlines. If you look at the facts, we're probably as aggressive as any American state, and we're about to get more aggressive. The extent to which that works, and please God that it works. And if you're driving in the roads in the state in the early evening, as I was last night coming home from Trenton, the anecdotal evidence is people aren't out there. You just don't. The traffic is way down. NJ Transit ridership is down 90%, 90. The extent to which we can crack the back of that, Madam Commissioner, it will be fewer weeks than more weeks. Is that a fair way to think about it?
It won't be as high, and it'll be spread out. That's exactly what we want to do. Same number of people may get infected and need some type of intervention, but it'll be more balanced. So that's what we're hoping with the mitigation interventions.
We used to have the chart. We don't have it today, but to Judy's point, not necessarily a different amount of infections, but a different shaped curve. And because of the shape of that curve, the healthcare system will be able to much more readily handle it. Mahan has given me the hook. One more? You good?
Yes, just one more.
Is that okay?
Quick one, Governor. it sounds like you're going to be rolling out the drive-through testing sites in other counties aside from Bergen and Monmouth. Can you give us any information? Will all of these testing sites the state eventually plans to roll out, will they be daily? Will they have the same hours? Are they all going to be 350 a day? And what counties and when can we expect those?
Too early to tell on most of the above. So Bergen opened today, and it will be open each day, again, beginning tomorrow morning at 8. We will open in Monmouth at the PNC Bank Arts Center and Homedale off of exit 116 on the going on the northbound side on Monday morning at 8. We are speaking, Pat and the National Guard are speaking very preliminarily with FEMA to see if they can be a co-sponsor on any more of those sites. By the way, FEMA is a partner in both Bergen today as well as Monmouth to come on Monday. And beyond that, I think you heard John talk about a handful of counties that you hope to have something going over the next week or so. Again, similar but different. So these are not FEMA partnered sites, but I think, John, you mentioned Burlington, Union, Essex, Ocean, and Hudson counties. Judy mentioned that we are looking, and we have been looking, I spoke to the majority leader yesterday, the day before, about what we can do in the south. Obviously, depending on where it is in Burlington County, that will reach meaningfully into the southern part of the state, but also as it relates to acute care beds in the south, which is not a testing question, but just to say, while the population is less in the south, the number of beds is also less in the south. And when we have more on that, we will come back to you. So we will come back to you. Mahan, going to make me an honest man here. As soon as we know, we'll give you the protocol on tomorrow, whether or not it will be on the phone or whether or not it will be live. And the only reason it would be live if we think we've got meaningful news to report, and I'm not suggesting the news we report of positive cases and fatalities is not meaningful, so trust me, I don't mean that at all, but if there's some reason to do that, we may be live with you tomorrow. We'll let you know as soon as we know. Sunday will be almost certainly on telephone. Usual time, I think we'll stick to that, would be 2 o'clock. I want to thank everybody from the far left. Tom, thank you for being here. To Bill Haas and John Cohen, I cannot thank you enough for your partnership of LabCorp and BioReference, respectively. We could not be doing what we're doing without you. Jim Tedesco, you're a star, one of our heroes. Thank you, buddy, for leading in the county where this has hit the hardest. Judy, to you, Chris, and your teams, 1,000 thank yous for your leadership. Josh, we can't achieve our dreams without your fierce leadership in Congress, and we cannot thank you enough for that. To our brothers in the National Guard, bless you. Colonel Pat Callahan, you are, when in doubt, we have a question. Let's ask Pat, my suspicion is it'll continue to be that way. Jared Maples, to you, and Jim, to your team who are with us here today. Again, thank you all. I want to thank Bergen Community College for hosting us so graciously, both outside and inside, and we'll be back to you as soon as we know what's next. Thank you.
Gov, thank you very much for what you're doing. And by the way, you've gotten your response times post-surgery from 24 seconds in a text down to 18 seconds. So I don't know whatever they did, you're faster.